So I casted his fingers. He's got the capsulectomies here and here. And his fingers, he has an ulnar nerve injury, so it was like really bent. So what I do is I got as much extension as possible, which is fine. Like if I could just get to 30, which is where I think I am, like I'm happy. I've included his IPs because they're also curled in. And what I've done is I've done it so that we can really focus on the MP capsulectomies, right? I didn't do this finger because it's fine. Well, when I casted him, his MPs are really stiff, so that's the beginning part of the video that you see. So look at how loose it is a little bit now, right? So we're gonna show right here, right? So it's much better MP flexion, so like about 60 or 70 right there, and then lower. So all I did was I worked on a ton of extension. Believe it or not, if you work on a ton of extension, you're gonna help flexion, right? So what I do is I just worked on, so there's two ways you can do it. So move back a little bit, relax your arm, relájese así. I'm gonna work into wrist extension and then finger extension. And then I'm gonna work against all his scar, right? Against all his scar. So I'm working on composite extension, right? I can also work on right here, where I go with my hand. I use my thumb. I'm gonna use my whole arm because I'm pushing this way, right? I'm pushing right at the wrist crease. I'm pushing this way. So I'm pushing, and then with this hand, I'm pulling, right? So I'm pushing, and then I'm pulling to get extension, and I could also do it individually. So one of the things I like doing when I work with people lying down is that I just have full control of their wrists and their fingers. All right, so I can also do it individually, so I could separate between and really, and so my thumb on the underside is, I'm gonna come up into that scar to kind of just shorten everything. I'm gonna go individually, right? And you would do it for a longer stretch. I'm just doing to show you. When it comes to casting, you want to look, especially if you're casting multiple fingers, or even if it's just one, you want to check in between the fingers. You want to make sure that these things are not pinching the skin, right? So I tried to like alleviate some of that. You're also wanting him to bend. So you want to make sure that if you're pushing in, it's a cutting into his palm. So I've had to pull back and had to break some of that. Break some of that cast out. Right? Soften that part. I went a little too deep. That's okay. We're not redoing it. So I'm just grabbing my fingers and I'm going underneath. I'm just breaking up some of that. It's coming tomorrow, so it's okay. The other thing is I left his fingertips open so I could see while he's here, is he losing any sensation? So you check for blanching. It goes white, it goes pink, goes white, it goes pink, goes white, and goes pink. He has numbness, so numbness might not be a great indicator for these two fingers. We can ask if he has more pain. ¿Tenés más dolor en los dedos? ¿Tenés más dolor en los dedos o está bien? Es lo mismo. Aquí? Okay. So I can like stretch them a little bit. They are stretching his fingers. ¿Tú sientes, how do you say tight? ¿Apriete?
¿Lo sientes apretado?
No, que me
Apretado.
pincha.
Le pincha, yeah. Okay, that's fine.
¿Por qué no corta con la tijera un pedacito?
¿Mejor? ¿Más o menos? ¿Mejor?
¿Mejor o todavía te está pinchando?
Ya.
No, porque yo empuje. I don't know if that's bland. It's not the cast. But look how much looser he got. Going into extension to go into flexion. All right, vamos.
¿Vamos a dónde?